Welcome to United We Spay, the show dedicated to promoting affordable spay-neuter services nationwide. Each episode delves into the heart of the movement, sharing inspiring stories and driving positive change. Our goal is to raise awareness, educate, and empower, addressing overpopulation's root causes to ensure every animal has a chance for a better life. Hosted by Stacy and the United Spay Alliance team, we're on a mission to change lives. Fed up with the fixation on symptoms in the animal welfare conversation, it's time to change the narrative. Join us on United We Spay, where we make a difference by spreading knowledge and building a compassionate world for animals. Let's put prevention first and spotlight spay neuter in the animal welfare space.
You're listening to United We Spay, a podcast from the United Spay Alliance. The United Spay Alliance works to promote accessible, affordable, and timely spay-neuter services because an ounce of prevention today can prevent untold suffering tomorrow. Spay Neuter, it's public health for pets. I am Stacy LeBaron, United Spay Alliance board member and host of the show. And today on United We Spay, we're talking with Becky Morrow, Dr. Becky Morrow, and she is a shelter veterinarian and professor who is very active in the animal rescue community. She founded Frankie's Friends Cat Rescue in 2010 after she cared for over 400 cats rescued from Tiger Ranch, a massive institutional hoarding facility. She has performed tens of thousands of spays and neuters and teaches high-quality, high-volume spay-neuter techniques to other veterinarians and veterinary students. Dr. Morrow is often called upon to speak on topics related to community cats and TNR, and has worked with dozens of shelters and rescues in Western Pennsylvania to bring the mobile surgical unit to underserved regions. In addition to being president and medical director at Frankie's Friends, Dr. Morrow is an assistant teaching professor at Penn State University and an adjunct assistant professor at the University of Florida College of Veterinary Medicine's online shelter medicine program. Dr. Becky, welcome to the show.
Hey, thank you so much for having me, Stacy.
So before we jump into this great conversation that we're going to have today, first and foremost, let us know, why are you passionate about spay neuter?
Well, again, I thought you nailed it there by saying we're stopping the suffering before it starts. I mean, it really is that is the main reason why we do this. We started the nonprofit based on that. We wanted to stop suffering, and we didn't start spaying and neutering. That wasn't our main focus. We were helping the cats from the cruelty case, but we realized very quickly that this really does prevent suffering in the future because of these animals that don't have adequate resources. They're outside. There are kittens that are not getting, medication, and they're sick, and we don't want that to happen. So we're trying to help prevent that. And that gives us that passion to do what we do every day.
When you became a veterinarian or decided to go to veterinary school, did you think you were going to become a high volume, high quality spay neuter vet?
I'm laughing here because no, I thought I was going to be a wildlife vet or exotic animals, because that's what we all think we're going to do. I think, I don't know. It's like I took all the classes for exotics, but I did have the same, when I think back, I did have the same reason for going to vet school, where I wanted to help the animals that I felt humanity had failed. So I was thinking wildlife and the animals that were being, injured and so forth, and that didn't have owners. So I guess it translated into this community cat passion, because that's the same population that really needs us the most. I'm happy to help with wildlife and other animals too, but that's where our focus is now. We just find that we can do so much good there, because if we can stop the issue of overpopulation at the source, that's going to help our shelters, that's going to help our communities, that's going to help our pet owners, that's going to help everybody. And it is truly public health for cats.
Yep. Yeah. And when you started your clinic, did you specifically help only cats that were being TNR'd, or were you doing shelter cats? Who were you serving? Because I'm sure there was a huge demand for your services.
Right. So strangely, we started because I bought a house for cats and I needed to pay for it. So, uh, as one does, you just buy a house for cats. And then you're like, well, I'm a professor. I don't make that much money. I need to find a way to help support all these little people, I call them. And we decided we're skilled. We're not going to do bake sales. We're going to do spay neuter and other surgeries. So we took whatever we could get. And I basically was just the goal was to support the cats that were rescued from that horrible situation. And I wanted to give them a life that, was really safe from harm and that they had a good outcome and they didn't have to suffer and they didn't have to worry anymore. And that's what we did it for. So we just took whatever we could get. And then we started to kind of focus more on other cats as those ones got better and we got some adopted out. And, as we were fewer and fewer of those cats, we started to focus on other cats. And that's when we really decided to do some work with the targeted trap-neuter-return and help other groups in the community to do what they do.
So we talk a lot about high volume, high quality spay neuter techniques. Do you think all veterinarians know what that means?
Absolutely not. And I actually just had a veterinarian at the one conference I spoke at tell me he didn't like that name because it was wrong, that there's no way that could be quality. And honestly, I was a doubter at first too, because the way we're taught, open them, basically they heal side to side, not lengthwise. So they're encouraging us to make large incisions. They're making excuses for it really, which, you don't think about it as a student. Everything they tell you, you kind of accept as this is the truth and this is real and this is the way it should be. But when you take a minute and think about it, it doesn't make sense. Why do we go to surgeons that do laparoscopic surgery? Because it's easier on the patient. You recover faster. There's less pain. There's no reason not to teach that. So honestly, most veterinarians don't know this is a thing. And that's what I think education is so important of a component, that it's just letting people know that, number one, this is a thing. And number two, our outcomes are amazing and even better than that in private practice. And we'll get more people to join the bandwagon.
Do you feel that then this is a technique that is really a best practice and everybody should be performing high volume, high quality spay neuter techniques?
Absolutely. I 100% agree with that because, again, the data is there to support it. Our experience, our outcomes that we see day in and day out are there to support it. These animals are running around like nothing happened. And, smaller incisions, faster surgical times are a good thing for the patient. And we were taught when we learned surgery that time is one of the 3 T's that we try to minimize in surgery, because the longer that they're under anesthesia, the longer that the body cavity is open, that's more opportunity for infection or for other, the patient to decline. So we really do want to have faster, more efficient surgeries. And that does not mean taking shortcuts by any stretch of things here. It's really just going to be being efficient, being really good at what you do, being so skilled that you can do this in a shorter period of time in a smaller hole.
How long do you think it would take a veterinarian that may have more of the traditional incision process in mind to go from an incision like a large one to what I think I saw in a video of one of yours? It was maybe a couple centimeters or less.
Yeah, it's the width of the spay hook. It's basically just the width of the spay hook. You can get away. If you can get a spay hook in, you can get the cat spayed in most cases. And what happens when people, first of all, don't think they can do it. So this is what I have to do. I have them in my presence and I coach them and I say, please try to make your incision from here to here and we'll extend it if you need to, I promise. So trust me. And they have to have trust in me. And they make the incision there. And I'm talking maybe about an inch incision and maybe even a little smaller at first. I'm kind of weaning them into it. And they find that they had more than enough room. And then they start to realize, oh my gosh, I totally did this. It gives them, it's not a matter of competence. We're competent vets as we come out, but we need to get the confidence. We really do. We don't have that. We don't have that camaraderie. We don't have that support network. And I feel that I love doing these workshops because I feel the support from one another. We build a little cohort and we can help each other out. They know they can text me if they have questions or just need me to cheerlead for them. And I think that's a big part of it because it's scary when we come out of school. It really is. We don't have that support. I was terrified to do surgery at first. I didn't do surgery for 9 months when I first got out of vet school, and I couldn't build up my confidence because that lag time and then just not having the opportunity. And I think that's very common with veterinarians.
So in that period of time, if you had somebody and you wanted to show them, is that a day that they would adapt to this and then they'd have to practice just to get even more comfortable? Or would it take them a month? What's the timeline? You're developing a training program. So what do you estimate the timeline being for these folks?
I will just by making a smaller incision, I'm going to chop their time in half probably, to be honest. What takes the most time is not the actual spay, it's the closure. So if by making that closure and having that half the size that you had, even if you just, had a larger incision and made it half that size, you've already greatly improved your efficiency. So just by showing them the small incision of what they can do out of it, that gives them the confidence is the word to do that and to practice that and to keep working to make that a thing that they continue to do, because you fall into that pattern. It took me a while when I first realized that this was doable. I taught myself how to do this. I looked at some videos from Humane Alliance and I just okay, I got to figure this out because I see another doctor over there who's more efficient. Let me figure out how to do this. And I had to think every time at first, because you kind of get in that mode where your hands go, you get that motor memory, you're just going with it. But you have to start by making a smaller hole and concentrate. And you realize that this is now the norm. And I mean, it's going to take you some repetition to get it under, constant, but really within a day, I can see people are already faster in these workshops that I run.
I know we've been just talking about the spay procedure. What about the neuter? I know everyone's, neuter just, it doesn't take very long at all, but I'm going to assume that there are techniques to make even doing the neuter faster.
Absolutely. And that's true. I mean, just because somebody might think 3 minutes is fast, but it's really should be under 30 seconds. It really doesn't take very long at all, because once you learn the special cord ties, and a lot of vets are learning that coming out of school, they have that already, that skill, which is great because that's transferable to the spays. But what you can do then is, you're really quickly tying. I think the biggest thing that slows people down is when I'm teaching the students or people that are new to this is the amount of pressure you got to tug, not to be inappropriate. You got to tug a little on that. So it's funny because when I was teaching students, I would go around and pull it and they would be like, "Whoa," like shocked at first. Like that. Yeah. There's a gubernaculum. There's a strong piece of connective tissue holding that there. You got to pull it. So once you get that down, it should be under 30 seconds.
So at Frankie's Friends, you've developed quite a few programs, and it seems like you're now very focused on training. And you have a training program that people come to your place, and in person, veterinarians will do a training program with you. Can you share some details about that?
Absolutely. Right. Once we realized that we don't want people to have to recreate the wheel. We don't want people to have to start and figure it all out. And there's so many great ways to do this. We're just giving people ideas and having a conversation and allowing people to explore the different ways of doing things so that it works the best for them in their situation. But we have workshops every other month right now. We're doing one day where we have the in-house kind of classroom training, so to speak. And then the next day we do a 50 cat clinic, which is not a big clinic to us, but other people are kind of surprised by that number, especially if I got my private practice folks coming. And they find that it rolls really nicely. And what still gets me excited every time is that the system works despite not having these people being together or working in teams before. The system works, and it's worked in the university setting. It's worked in this setting here. It's worked in other clinics. And that's what's really cool. Once you get the system and then we can transfer that knowledge, then anybody can do this. It's just really having somebody there to tell you, yes, you can do this, and being there to support you through the process. And then we do have an online version of that where they can get the 6.5 hours of RACE approved credit that will be available online at any time. And then if they want to come later, we're happy to have them come to a clinic day. They can come when we're doing one of our normal clinic days. We're just here to try to help and support and give them that ability to practice and use those techniques that they learned.
One other thing I think it's important to mention too, being in Pennsylvania, if I'm a veterinarian in Ohio, I could still come to this without getting my license for Pennsylvania, correct?
That is correct. Yes, we have a law that allows for 10 days, people can come and help at nonprofit clinics or when it's helpful to the public health, and this is public health for cats. So we do have that availability. If you're a veterinarian that's licensed in another state or in Canada, then they are able to take part in this program.
That's really fantastic. Of the veterinarians that have come to your training sessions, where are they from?
This is great. I know. I have people from all across the country, and we've only been doing this for a year officially. It'll be in January, but I've had a veterinarian come from Australia, even Palau. Is that how you say it? She's from the island. I've had Canada, all over. So it's been really nice. I've had whole groups come up from Georgia, from Chicago with the team. We really love when teams come because then we can get the whole group, in sync. It's one of those things where it's a team. I mean, and that's what I talked about before. It really is a team sport. You need the whole group. I'm only as good as my team. They keep me seated in my spot and doing the surgeries. If I need to go and do other things, then that just decreases our efficiency. So the fact that they are really good at doing what they do, helps everybody move along. And those are skills that anybody can learn. Even my pre-vet students, I have come in and we teach them how to do prep and how to do these things. And we are able in our state to have veterinary assistants. So we're allowed to do that. And it's great because we see these students that otherwise would get very little hands-on experience go to vet school and they're intubating cats by themselves and they're drawing blood by themselves and they're so far advanced because they've had this experience. So it's win-win. They get the experience, we get the help, and the cats get spayed and neutered.
Right. How many technicians or veterinary assistants do you have supporting your work?
So when we're on the mobile unit, that's going to be a situation where you have the community helping us. And they do the intake and release of the patients. So there's just 2 technicians and me on the mobile at the time, and we can do 60 cats. And again, it's just a matter of the efficiency in the system that we have, how it works and how it flows. We get a flow going. In the clinic setting, there's more other cases coming in. It's not just strictly spay neuter. So we usually have 3 technicians or assistants, and we do have a person working, to admit and to discharge patients.
And that's to support you, or do you ever have any other veterinarians on site?
Yeah, we have some of our trainees and we have other volunteer veterinarians. I was just down there today and I saw one of the vets that came through the workshop comes every so often now on Tuesdays. And it's wonderful because, again, they're helping the community by helping us and they're improving their skills. So I would love to have more vets. And, I would usually say probably 2 techs for 1 veterinarian, and then you need to add more techs if you got more vets because we want to keep that balance and we don't want anybody to get overloaded. This has to be something that is sustainable too, right? This is not something where you can get burned out. We don't want that to happen. We want this to be fun. We want this to be sustainable. We want this to be a team and it's fulfilling. It's not draining. We don't want that.
So let's touch upon that topic of burnout for the veterinarians as well as technicians. We've heard, those of us in animal welfare, we've heard a lot about veterinarians are leaving the practices, they're retiring early, they're working part-time. What are you seeing with regards to veterinary shortage as well as technician shortages?
Right. And I've seen a lot of shelter veterinarians that aren't even practicing veterinary medicine in the traditional sense now. And it's horrible because we're losing people that we are, in critical need of. And I think there's a lot to this issue, but I think a lot of it is just having that support from your, not just the team, that's one thing, but having boards of these organizations and other people realize what's happening. I think there's a separation sometimes with boards not realizing what's happening in the day-to-day, and that disconnect often has decisions being made that aren't really going to work out well for the medical team. And then that ends up putting more stress on them that we don't want to put on them. And then it becomes something that is not sustainable. So it really, I think, is an understanding and learning and more people that understand what we're doing, even if they're not part of the medical team. I think that's better for all of us, because give empathize and see what barriers we're trying to overcome and what stressors we're dealing with, and try to help minimize that so we can keep our teams intact.
Do you have any recommendations on what we can do to encourage more veterinarians to work for nonprofit clinics?
I think just showing them, this is helping a lot by showing them the behind the scenes and what we do. I think we're selling ourselves, because it is really a great thing to be able to say, listen, I want to help as many animals as I can. I don't want money to be the main factor in this. And so often veterinarians are in positions where they're limited by resources, and it's funding and it's other things that are associated with that. I'm not saying we're not limited by resources, but we use our resources in a way that is allowing us to help more animals and to provide more services to the community. And that's something that I think any vet that cares about the animals of the community wants. So if we show them what we do, if they can train with us and they can see these animals that we're helping and how it really will resonate with your calling, being a vet, I think that is a big part of it. So more education, more behind the scenes, seeing what shelters do and what we do in this crazy cat world of ours. I think we can attract more people.
One last question. Thinking like the private practice veterinarians, if they did adapt to a high volume, high quality spay neuter environment, do you think that would increase the number of spays and neuters that they would do in the practice?
That is the goal. And we have a little bit of data on this so far, and I will get more data, but we did present a poster on this to try to understand. That is our plan. And we want to always look at data to make sure that our plan is working as we expect, or we need to tweak it. And it does show that these veterinarians that came through our program felt more confident, and they're more likely to hold a cat clinic, even though they're in private practice. They're more likely to help with cat clinics. They're going to see, even if they see 5 more patients a day, that would make such a big improvement in what we're doing here. I mean, can you imagine if every vet just put 5 more cat surgeries on their schedule a day and, was able to decrease the price because of their efficiency? That would be amazing. And that's really, I think, what we're trying to go for is get more people recruited to the cause. And I say it lovingly, drink the Kool-Aid. And that way they join us and help us, and we can all work together rather than having these different little private practice versus shelter medicine versus let's all just help these animals.
Agreed. 100%. I agree with you so much that I think that cats are very good at having kittens, and therefore we all need to be helping reduce that overpopulation situation by far. One other topic that is near and dear to our hearts at the United Spay Alliance is feline fixed by 5. And that means we want to have our cats or kittens spayed by the time that they are 5 months old at the very latest. That is the latest. Do you agree with that?
100%. Absolutely. Yes. There is no reason scientifically, medically, as to why we wait till 6 months of age or later for cats. There's absolutely no evidence to that. We just somewhere along the line pick that as the time. And yes, this is antiquated. This is one of those traditional things that just because we've always done it this way doesn't mean we should. So absolutely 1.5 pounds and above, we have had no problems any different with those small animals, those tiny ones versus any, other patient. They're not showing any higher risk of complications. They go home the same day, just like the other kitties go home. They run around like nothing happened. They're resilient little buggers. So I'm much happier doing that before we have a pregnant kitty. And a pregnant spay is going to have to be a little bigger hole. I mean, that's just part of the tissues are bigger. So getting that before we get to that stage, getting them spayed and neutered is great. We're 100% behind you there.
If there are any veterinarians out there that are interested in partaking in your training program, either in person or online, how would they reach out?
Oh, we're happy to have them. And if they would just find Frankie's Friends Cat Rescue, and it's www.frankies-friends.org. We have a training sign up there. We have our contact information there, and we are happy to entertain anyone who wants to learn these techniques. We will find a way to get you here and teach you some good stuff.
So, Dr. Becky, if folks only had one takeaway from listening to our conversation today, what would it be?
I think that we are more powerful together when we work in collaboration, and we can really make a big difference in these lives of our little kitties out there in the communities. We just need to keep sharing information, educating others, and coming together and working towards this problem. It is something that we can get under control if we all work together.
Thanks so much for listening. If you liked this episode, be sure to share and subscribe. We'll be releasing a new episode each month, digging into important conversations surrounding spay neuter throughout the U.S. and around the world. Find more resources for spay neuter and learn more about our work at unitedspayalliance.org. That's United, S-P-A-Y, alliance.org. Get in touch with us anytime by emailing info@unitedspayalliance.org. Until next time, thank you, Becky.
Thank you so much, Stacy.